Welcome to the session, Childcare in the Public and Private Sector of the Iowa Ideas Conference. I'm your moderator, Sarah Conrad-Baranowski. I'm Deputy Managing Editor at the Gazette. This session is within the Community Development track of the Iowa Ideas Conference. During our time together today, we're going to talk with our panelists, and we hope to address audience questions. If you have a question, you can type it into the Q&A box, and our tech host will forward it on to me, and I will be able to ask the panelists. This session is being recorded and closed captioning is available to you. If you have any tech questions during the session, you can also put those in the chat box and our host will be able to help us with that. So we have a lot to discuss today, so let's get started. I'm joined today by three panelists. They're Brian Melhuse with West Liberty Foods, Angie Ray Duncan at First Children's Finance, and Dawn Oliver Wyand at the Iowa Women's Foundation. I just want to start by giving each of them an opportunity to introduce themselves and tell us how they're connected to childcare issues in Iowa. So Dawn, we'll start with you. Can you tell us a little bit about yourself?
Hi, thank you everybody. I'm excited to be here today. The Iowa Women's Foundation works to improve the lives of Iowa's women and girls through economic self-sufficiency. And I have the great privilege of being the president and CEO of the organization. And we're excited to be able to share with you some of our work across the state and how we might be able to help you within your communities as you move forward with the childcare issue.
All right, Angie, could you tell us a little bit about yourself?
Yeah, thank you. I'm Angie Duncan. I'm a Senior Business Development Specialist with First Children's Finance. And First Children's Finance is a national nonprofit organization that works on childcare issues. We really focus in three areas, and that's working directly with childcare businesses. So on the business side, we also work with communities that are looking to expand or retain their childcare supply. And the third way that we work within childcare is on the systems level. So we do have staff across the country that work with state level as well as federal as far as legislation and rules and guidelines.
All right, thank you. And Brian.
Hi, my name's Brian Melhuse. I'm the General Counsel at West Liberty Foods. West Liberty Foods is a farmer-owned company based here in Iowa. We primarily, our core business is turkey. But if you've ever eaten at a Subway restaurant, there's a good chance that we sliced that meat. So we have operations at Illinois, Iowa, and Utah. And kind of what drew me to the panel today is we're donating $750,000 to be matched by the state of Iowa through the Future Ready Iowa grant program for nonprofit child care center in West Liberty, the only early learning childhood center in our community. So hope to provide a kind of an employer's perspective to the extent that I can, and excited to be part of this panel.
Yeah, I'm so glad you decided to join us, all of you. So let's get right into the questions because this is a very big topic. Dawn, I wanted to start with you. The Iowa Women's Foundation has taken a lead in the conversation about childcare in Iowa for a number of years now. Can you share with us a little bit about how the foundation got started down that path and what its connection is, or what the connection is between childcare and employment?
Absolutely. So thank you. So as I shared with you earlier, the Iowa Women's Foundation works to improve the lives of Iowa's women and girls through economic self-sufficiency. And we work to break down those barriers that are keeping women from being successful. And back in about 2016 and 2017, after a year of community conversations and hands-on research, we learned what those barriers to economic success were: employment, childcare, housing, education, training, transportation, and mentorship. After we learned what those barriers were, we went back to our communities that we were working with. We shared the information and we said, now, in a perfect world, if you can start working on one of these barriers, which one and what do you want to do? Over half of the communities chose childcare as their number one issue. And quite honestly, that surprised us at the time. We thought it would be employment and education and training or one of the others, but certainly not childcare. So we did what we do best. We went back and we looked at the research. We heard what our communities were telling us. and the research then backed it up. We had a shortfall of quality available childcare across the state of Iowa. And we also were looking at the workforce issues across the state of Iowa. And the Women's Foundation truly believed that both of these issues are interrelated and dependent on each other. You can't go to work, you can't get education and training, you can't take advantage of apprenticeships and other programs if you don't have childcare. And so we did what our communities asked us to do, and we started focusing on how can we increase the availability of quality, affordable childcare across the state so more women can go to work, get the education and training they need, and really become economically self-sufficient. And we knew that there were many, many communities and community partners out there already working on it, but we needed somebody to kind of take the lead. We needed somebody to kind of say, okay, let's bring everybody together. Let's share our, our resources, our tools, our connections. And that's really the job of what the foundation has been doing now since about 2018, is how can we get businesses involved? How can we get schools involved? How can we get elected officials? How can they all lead the way and help? And I hope that through this conversation today, I can share some of those with you, and we can talk more about how can different sectors or individuals help in the childcare issue. So I can tell you more women can go to work and become economically self-sufficient.
Yeah, well, and you've been having these conversations all over the state in many communities, and you've been talking to parents, community members, businesses also. So when you started these conversations, and I'll open this up to anyone because I think any one of you could talk about this, but what do you say? Why would an employer offer childcare as a benefit? What are the risks for that and the rewards? Because I think, we used to see it as just a family issue. You need to go out and find your own childcare, but now we're kind of seeing an evolution, and Brian can speak to this, where employers are starting to offer childcare. So why are we seeing that shift?
Yeah. So, I'm sorry, Brian, let me throw some data out there, and then you can come in and say why West Liberty Foods made the decision, because there is a really great report out there that I would highly recommend all business leaders take a look at. It is a Iowa report that was put out back in February of 20 by the National Chamber of Commerce Foundation. And they actually looked at how was childcare impacting our businesses around the state. And we're losing almost $1 billion a year to our economy in the state of Iowa because of childcare issues. We know that $153 million is being lost in tax revenues. And we know that businesses across our state are losing over $750 million a year to their bottom lines because of work productivity loss and recruitment and retention. So businesses that are making an investment in childcare and are staying with it are really seeing that it is impacting their bottom line, and it's helping with their employee recruitment and retention and productivity loss. Now, I'll let Brian share with you as a business leader, how they and why they made the decision to move into this.
Yeah,
I think everything that Don's saying is spot on, right? So you can't have employees show up to work without quality, affordable, available childcare. It's just a necessity, and we know that our biggest asset is our team members. We can't operate without the men and women that come to work every day for us. And we know they can't come to work without childcare if they have kids at home. And this is an issue that's been front of mind for us for a long time. I think it came into pretty sharp focus during the pandemic, but it's something that we talk about a lot as an employer. So for us, especially in our industry, the food manufacturing industry, it's tough to attract and retain talented folks. Always has been. It's something that we talk about internally a lot. And so how do you become an employer of choice? How do you attract and retain the people that are necessary to be successful as a business? Well, in our view, you can't do that without a community of choice. And that means filling any gaps in your community as the employer. If you need to, stepping in, leaning into those services that are needed. And oftentimes Don's right. it's childcare, and that's front of mind every time we have a conversation with a candidate. They always ask, how are school systems and what's childcare like? Where do you send your kids for childcare? So we had an opportunity back in 2008 when we opened a facility just north of Salt Lake City in Tremont, Utah, to open a childcare center. We recognized that as a need and a impediment, a burden, or a barrier to clear in order to attract and retain the people needed to operate that facility. So we opened a childcare center there in 2008, and we took kind of a different approach. We looked at this and said, okay, well, what's the best childcare facilities out there? What are they doing? Let's take a look at that. And then we said, all right, well, how much would it cost to operate a facility like that, to offer transportation to and from, school events, to do field trips, to have a well-staffed facility that's not stretched so thin with staffing ratios that we see as one of the major problems for childcare centers across the country, really. So what does that cost to operate? We looked at it and said, okay, let's just do that. Let's try to offer the best that we can. So we've been operating a childcare facility under that model for over a decade now. 65 kids out there. It's a very successful program, a big wait list internally. Certainly something that we're proud to talk about when candidates come out and interview for positions in Tremont. Unfortunately, our facility here in West Liberty is a little bit more constrained with respect to its footprint. So we can't, in our current footprint, add on to allow for an on-site childcare facility. So we saw this program rolled out and recognized it as an opportunity to invest in something that already existed in our community. So I didn't want to cannibalize the good work that was already going on in our community. And instead of operating our own childcare center, we opted to invest $750,000 with a matching grant from the state to expand, basically double the childcare center in West Liberty. So that's kind of how we looked at it. Really, for us, the West Liberty investment was just that. It was a value investment. We weren't necessarily looking at it on a return standpoint, and frankly don't really expect to see much of a return in this environment. I mean, it's just, you do everything you can to create a community of choice, and that's really why we made the decision to invest in this program. And hopefully other employers across the state are taking advantage of this, because it's a great opportunity. It would be a missed one to bypass it. So that's kind of what we were thinking. Dawn's absolutely right, though. I mean, she's hitting on the data points behind the conversations that we're having internally all the time. So
Angie, I want to bring you into the conversation because I feel like this kind of hits on your expertise. Can you talk a little bit about, you kind of approach it from, if a community or a business decide they want to open a childcare or expand a childcare, you provide quite a bit of assistance for them and some expertise. Can you talk a little bit about that?
Yeah, and this is the sort of thing that we have helped multiple communities actually across the country work on. And even here in Iowa, Brian said, being the employer of choice, that really stood out to me, because I can recall a community I worked with just a couple of years ago, and we were working on analyzing, what is their supply and demand. And there were several parents that commented, such and such company in our community has on-site childcare. I've been trying to get a job there. So it really can be that recruitment and retention tool for employers to find their workforce. And we've had projects that we've helped, start a new on-site facility, and that can look like different, many different ways to do that. The employer doesn't necessarily have to own and operate it. Maybe there's just space they can lease to someone else in the community. Maybe they do own and operate. Maybe they hire a third party to come in. So, what we heard back from those that have had successful programs is, there may be some loss. The tuition sometimes doesn't cover all of the costs, but to them, that was okay. That little bit of loss that they take on childcare is just like providing health insurance or retirement plan. That's an employee benefit. So to them to figure out how to make the finances work was okay. And sometimes if they have, here's an opportunity for our employees, it costs. If you're not one of our employees, but we still have open spaces, someone in the community pays a little bit more, but then has access to it. So the employer can kind of subsidize the cost for their own employees to have affordable childcare, because that's a whole nother issue that we can talk about, what it takes to make a childcare program break even, and then what that means for parents to pay out of pocket. So I think, Brian really hit on it there with the employer of choice, and really that's the benefit for these employers to be involved on some level.
So say you're a community or a business or even just a group of parents who identify that, what we really need is more childcare or a different kind of childcare. How do you start the process of addressing that need? It feels like such a huge, elephant to, figure out how to create more childcare spaces or change what's available to the parents in your community. Have you seen, any one of you could answer this, but have you seen approaches that work really well that lead to success?
So I'm happy to start, and I know that my colleagues on the panel can certainly add on to this as well. This is what the Women's Foundation has been doing now since about 2018, is working with communities and businesses and people who know and recognize that there's an issue, and they don't know what to do and they don't know how to get started. To be honest with you, it is a huge issue. It's going to take more than just one solution to solve the problem in a particular community. And so what we've been doing is we'll go into those communities and we'll host sessions and have conversations and talk about some of the different solutions that could be available to them as a community. And then based on that conversation, they can decide, okay, what do we want to do? How can we as a community move forward to increase the availability of childcare? So that's how a community can do it. If a business is interested in getting involved in childcare, the Iowa Women's Foundation has partnered with the Iowa Economic Development Authority and hired an employer engagement director. This individual is available to work one-on-one with a company that might be interested in making an investment in childcare for their employees. Again, the solution is going to vary from business to business. It's going to depend on their employees' needs. And so the first thing we recommend is that you survey those employees, find out what their needs are. And we have those surveys that you can use, so you don't have to start all over or recreate the wheel. Once the surveys come in, you review them, and then you decide, okay, how can we as a company meet these needs, and what are our different opportunities? And honestly, we're seeing all kinds of things that are happening right now. As Brian said, they've got an on-site center out in Utah, but here they're partnering with the local center. We're seeing businesses come together and pool funds to help supplement wages. We're just seeing all kinds of different ways in communities trying to address this. We're here to kind of help guide you. We're not going to make those decisions for you, but we're going to share with you resources and tools and connections that you can then kind of hopefully figure out what's best for you, either as a community or a business or a school district or a group of parents. How best can you move forward?
Angie, what have you seen because you've worked with lots of businesses and communities. How do you create that successful, how do you get started on a path to future success?
Yeah, so just a little bit kind of what we've been doing, and what we do is maybe not the perfect fit for every community. So I want to, say that first, but there are something that we've been doing with multiple communities, and recently Iowa Economic Development Authority has invested in is childcare market studies. And they've done housing and other things too. So kind of like Dawn said, first of all, figuring out what's needed, looking at the community, kind of measuring what's the supply and demand today and what's important to parents, even things that regulated care versus non-regulated, or do the parents really want to try and not use childcare and instead adjust their work schedules so they don't need outside childcare because every family is so different. So getting that sort of information and then bringing the community together to look at solutions. And again, there's so many different things. And like Dawn said, one thing is not one type of childcare in most communities isn't going to fill the full gap that they have. It's going to take a couple of different providers or different settings, homes and centers, and getting schools involved. So for the community standpoint, to really figure out what's needed and what will fit the needs of the community. But then often carrying out those next steps is what becomes a challenge. Who's going to be in charge now? If, say, the community decides, one thing I used to see, I previously worked in economic development and would work within my own communities on this. Who's going to be in charge now of starting this new, community nonprofit center? And a lot of times that's where it would kind of die out. Just we would spin our wheels. We have to have some good influencers and people who are in it. These things take time. If you are talking about building a new facility, it can take multiple years. Construction costs are getting pretty hefty. So even the time it takes to fundraise and just having the right people at the table. And it's, it used to be that everybody just kind of said, well, the parents should work on that and figure it out. But if they're working and they have children, that sometimes that can even slow down the process if they need some help. So assuming that, well, the parents are just going to get together and create this new program is one thing that we're seeing that does not always work. They need help. They need community engagement, and having those employers and businesses at the table as well can really help with that on multiple levels.
Brian, how did the process work for West Liberty Foods? I assume that you don't just decide, well, we need childcare and then make it happen in, 6 months or so.
Yeah, so this is, again, it's a conversation that we have all the time internally. It's childcare and providing it for our employees is something that's really important to leadership at our company. And our new CEO, Brandon Ocken, led this effort for us. And it's an easy decision at the end of the day. I mean, we're in an employment market right now where it's tough, right? And you have to do everything you can. And I talked about it earlier to create that community of choice. So if there are other communities out there struggling with this, I'd encourage you just to go to your large employers and talk to them about the need for childcare. And I would be surprised if you don't get a really positive response, a really open conversation about, what can be done. And that's one of the benefits, I think, of doing business in Iowa is you get to have those conversations openly. We have great employers across the state. I mean, Vermeer and Pellet, my hometown, Casey's, Comigo, Hy-Vee, John Deere, Brockwell Collins, just great employers across the state that will have very open conversations about meeting community needs. So we're happy to be in a position to do that for our employees in West Liberty, but it takes a village, right? It can't be one employer for the most part. Everybody's got to kind of lean into that conversation and find a solution that fits well for everybody. And this isn't, as Don and Angie are saying, this isn't anything really new. I think the pandemic has just brought it into sharper focus. Parents have been doing this behind the scenes for as long as they've had children. So they've been struggling to find solutions that work for their families. And we actually learned about this program through Debbie Durham at Iowa Economic Development Authority and some of the resources that Don was talking about. I mean, we utilized those to identify the need in our area. It was overwhelming. And so we knew we had to do something about it. So we were proud to be in a position to support it. But I know we're just one of many employers that are either doing the same thing right now, have done the same thing, have on-site childcare, or looking to provide that. So that's my perspective on it.
You touched on this a little bit, Brian, but how did the pandemic change the childcare landscape in Iowa? Have families' needs changed? Are we meeting those needs? Have providers' needs changed? Feels like a big question.
Yeah, I think the pandemic was a sea change, I think, across many industries. Looking at it from the provider's standpoint, the childcare provider standpoint, there's a lot of stress on providers right now. They're being asked to do more with less. They're being asked to watch more kids with fewer providers, and I think a lot of parents were rightfully nervous about continuing to go out to work, and that's keeping a lot of people, I think, still on the sidelines and out of the workforce. That fear of bringing the illness home or of your child getting sick is real. I'm a parent to a 3-year-old, so I've got a runny nose right now. So it is a real concern. I think that's part of the challenge. In our industry, of course, the pandemic was very difficult, and we did everything we could as an employer to lean into those conversations to make sure we were meeting all the needs of our employees. But at the height of the pandemic, we were 600 people short. Tough to operate a business like that. And fortunately, it's changed, and I think some of the things that we've done, raised wages, provided paid sick leave for anybody that was positive with COVID or who could have been positive through an exposure at our work. So we saw voluntary reports of a potential exposure to that work go way up because people knew that they would be paid while they were out on leave. And I think that was really effective. And then implementing on-site testing and having the vaccine available early and often for those who wanted it. Those things really helped us through the pandemic, but we're seeing childcare as a lingering issue. And I think Dawn was saying it, but she's absolutely right that there are a number of people on the sidelines in the workforce right now that could be working, that want to work, but are not because of childcare concerns. And that's a big deal, not just for our company, but for companies across the state and the country, really.
Yeah. So, Brian and everyone, I would say to you, if the pandemic did anything, or if there was a silver lining at all to it, is that it showed that childcare really is an economic issue and a workforce issue, and no longer just a family's issue. We saw almost 54,000 women leave the workforce during the pandemic, and many of them have not returned because of childcare. And prior to the pandemic, our issue really was we just didn't have enough childcare in the state. And now I would say to you, in many communities, that there are openings in centers and in homes, and they can't find the workforce. So now we've gone from not only not having enough, but then in those communities where we did have enough, they could take more kids, but because they don't have the workforce, they can't bring them on. So now we've got to figure out how can we increase the availability of their wages and benefits so they can provide the care. And then that's another thing that we're starting to look at is what could those possible solutions look like? I heard Brian say they raised their wages. Well, so did Casey's and Hy-Vee and Walmart and everybody else, and childcare providers just can't keep up with it. I tell business leaders, imagine if all of a sudden you lose half of your income because you, in a childcare provider situation, they lose their kids, which is their revenue source, and they start to see their expenses go up at a rate that they can't control. Food costs, health and safety issues, all of that. That's what childcare providers across our state are dealing with, is their revenues are going down and their expenses are going up, and they're struggling to make it work. And we've got to figure out how we can help them, and not on the back of our parents and increasing fees, because our parents are already paying well over the 7% of affordability rate that DHS recommends.
I'll pick up on that. You're absolutely right that you can't just pass through wage increases onto parents. That's not fair. It's not right. So something else has to happen. In Tremonton, for example, our healthcare, our childcare providers are West Liberty Foods employees. So they get full access to our benefits package, retirement, healthcare, vision, dental. I mean, you name it, they're covered. And I think that's a big deal. And that's something that small centers don't have the opportunity to provide. And it's something that partnering with a large employer can help solve. I mean, you can offer benefits to those providers through that employer. And there's some structuring and some policy issues that you have to work through, but they're not insurmountable. And the overall cost to the employer is not significant. So that's something that we've certainly seen, but raising the rates for childcare, what parents pay. I mean, for us in Tremonton, that gets passed through to our employees. And so we're probably at a third of the market out in Tremonton. So certainly you don't have to go that far, but it's untenable to pass that through to working parents who need this childcare, and frankly, the employers need it too, because they wouldn't have employees without it. So that's I just wanted to echo some of the things that were mentioned there.
Sarah, can we just say I'm kind of worried because West Liberty Foods is a fabulous company and they've made a great investment, but they're also a larger company. And I would assume that we might have smaller companies on the call thinking we can't even, we can't have our own childcare center to do this because we don't have that many employees. Well, there are ways that smaller businesses can make an investment in childcare. And there's consortiums that can be formed within a community where 3 or 4 or 5 smaller businesses can come together and do something. And we have examples of those kind of partnerships that we can share as well. So I don't want the businesses to think that they have to be at a certain level to be able to make an investment in childcare.
Could you, do you have one of those examples that you could share with us, something that has worked for smaller businesses?
So what happens is, so for the grant that Brian is talking about, you had to have at least 75 employees to qualify for the grant. But in addition to that, they could say, but you could get 3 or 4 employees or employers to come together who might, have 20 or 25 employees, and they could do the same kind of work, but they would do it as a group rather than as an individual employer. And we're seeing that happen. They're doing it up in Waterloo right now with a couple of projects, and they're doing it in other parts of the state. And if I don't have it exactly, we'll figure out and connect a group that might be interested in doing that to somebody who is already doing it so they can learn from them.
That's great information. Thank you.
I have another example I could share. Here, one that we've seen recently of business that can't get deeply involved, but to help with the offsetting of costs then of a new childcare center in their community, they're going to employ the center director. So it gets that salary off the payroll of the childcare business that's already, going to be tight. And that also gets that center director who's really going to be the CEO of this company, the benefits that employer can offer that to their employees. So it's a little tricky, a lot of legal agreements they had to look at and clearly define who's supervising, who's hiring, firing, and has say so. So it's not a quick, easy thing, but that something like that could be a solution. It's sort of a shared employee, but their main focus is to serve as that center director. But it's sort of a win-win. They can't own it.
So it sounds like there are ways to be creative about making this work. It's not, oh, I can never afford that, so just shut that down and never visit that issue again. I had on my list of questions, and it's been brought up in the Q&A by some of our audience members about pay. So Dawn, you touched on this a little bit. we can add new centers, we can expand spots, but if we can't find employees to work in these childcare positions, we can't take care of more kids. And then we're in the same boat. And so how do we, part of the issue is finding people who will do those jobs. And part of it is pay, being able to offer competitive pay without increasing the cost of childcare, which if anyone has ever paid for childcare, they know is not inexpensive. How do we begin to address that issue? What have you seen an example where it works, where someone is able to raise those wages to a point where people can make a living wage while working in childcare?
Absolutely. And I think there's a couple of examples. And again, we have to step out of the box and be creative because this has not been done before. So there is no right way or wrong way. So as Brian said, their childcare employees are West Liberty Food employees. And so that really helps. We have, some companies where they'll help subsidize directly the wages. But the most unique thing that we've seen that's really starting to be replicated across the state is what was done in Hamilton County. And that's where the city put in some ARPA funds, the county put in some ARPA funds, and then they went to the businesses and they asked each of the businesses to make a 3-year commitment to this fund. The fund is housed at the community foundation, and the dollars are used to help supplement the wages of the child care providers at the different centers in the county. I think the last thing I saw was they raised almost $750,000 that's now sitting there in this account. So the center may be able to pay $11 an hour, but they really want to be able to pay 15 or 16. Well, they pay the 11 and then they apply to this fund and they get the additional funds to help supplement that. I haven't seen this done, but I wondered why we couldn't do that with benefits as well. Could the child care centers sign up and get going with benefits and then apply to the funds to help cover the costs of those benefits? I think that's something that we should be looking at as well, because we know that being able to provide benefits would help too. So that's just an example. We've got the different tools that were used with that. What does it take for a business or for a child care center to qualify? How do they apply? How are the funds distributed? All of that is available and is willing to be shared because we know that our communities need help. And we want to make sure that everybody has the opportunities, the tools, and the resources that they need.
Angie or Brian, do you have thoughts on how to make this work financially?
Yeah. Oh no, go ahead. Angie.
It was like Don said, it's creativity at this point. We've had a kind of a similar thing where we've had some other communities where they know if they go out and ask their businesses to subsidize the payroll of another company, they're not going to be favorable to it. So they're looking at other ways to set up basically grants for operating for these programs so that it kind of frees up some of the other money that they can increase wages. So it's sort of same thing, but reframing it. Because it is a hard message sometimes to go to another company and say, we need you to help pay for our employees. But if they can reframe now, we need help paying for food costs and cleaning supplies. And those are some of the big things that the surveys we're doing currently, we're hearing from providers, those effects of COVID as the operating costs have gone up. So it kind of frees up that money so then they can pay more in their wages. For sure. And there are some state programs too that previously each county had to fund their own if they were going to participate in a statewide program, but the legislature has put funds into a salary stipend program that, we don't know the fate of that. Will it continue? Will the funds continue? Unfortunately, right now, there's a lot of money coming in. A lot of it's one time. So how do we sustain that over the long term too? Is kind of, I think we may have some unintended consequences a couple of years from now when these funds are all gone, if we can't get our communities helping to chip into the pot now.
Yeah, and I'll just add, you're right. It needs to be a sustainable approach. But I don't think it's all about pay either. It's about recognizing the needs. It's no different than any other employment position that you're trying to fill. It's about recognizing the needs of that individual who's going to be serving in that role. And for childcare providers, it's no different. I mean, if you talk to the childcare providers, and we have out in Tremonton, what's your primary motivation? What gets you out of bed in the morning for this job? It's that they love taking care of kids, and we just need to clear the obstacles that are in their way from performing that important role. And sometimes it's wages. Right now, it certainly is, but it's also benefits. A lot of these providers are the breadwinners for their family, and they need to be able to offer to secure benefits somewhere. You can't go without insurance, and insurance is so expensive that's a big part of this as well. And another big part, I think, is the staffing ratio. I think we're seeing a lot of people leave the childcare industry because they're being asked to do so much with so few resources, and not overstretching, not testing the limits of what those staffing ratios can do. I mean, that there's a legal requirement for staffing ratios, but then there's also what's appropriate and comfortable for providers and children. And so I think those three things: pay, benefits, staffing ratio. I think those are three of the things that many childcare providers, at least from our perspective, talk about as being the most important. So it's about meeting all of those needs. It's not just going to be pay in a lot of circumstances. And a kind of a small world moment, that Hamilton County is where Ellsworth, Iowa is. That's our chairman, Paul Hill, and his family farm out there, and I'm familiar with what the good work that's going on out there with their childcare program and what they're trying to put together. So a creative approach, I think that's it's going to take across the state. And that's just my perspective on it.
So last year, Governor Reynolds announced several initiatives to address Iowa's childcare needs. They were in response to a task force report that looked at childcare and what could be done to help the situation in the state. They included a childcare management system, $10 million in funding for the Childcare Challenge Grant Program, money for blended childcare and preschool opportunities, and then $200 million in grants for childcare providers' losses due to the pandemic. Is that enough? Is there a role that the state should play in this, in funding? I mean, we've talked about some of these creative funding scenarios, and the Hamilton County one is great, but the 3-year commitment, then what do you do after those 3 years? Hopefully the businesses who contributed to that see the value in it and continue to provide funds for that. But how do we make this, and this kind of goes off of what all three of you have said, how do we make this sustainable? Do you see this as a statewide approach, or is it going to be kind of community by community and figuring out what works best in each location?
All of the above, Sarah.
Yeah.
in my opinion. What the governor has done is a good start. And we're really excited that she's made childcare a priority and that they're making investments in it. But Angie addressed it earlier when she said, but this is with one-time federal funds. What's going to happen when those funds are no longer available? We have to start thinking bigger, bolder, creatively, and more long-term. And what does that look like? It's going to be different from community to community, but I believe it is so big that it's going to take a public-private partnership. It's going to take public dollars. It's going to take private dollars. It's going to take nonprofit dollars. I think we can all come together and figure out how to make this work, so it's not being dependent on just one source.
Yeah, I think that's absolutely right. We're incredibly lucky to have the leadership that we do in this state, and Governor Reynolds got the conversation started, and I think the conversation is going to keep going as part of the grants that have been provided. It's a start, certainly. More needs to be done, but it can't all come from the state, and it certainly can't all come from the private sector. Many businesses out there majority of businesses in our state are small businesses that are going to need help and creative solutions. And I think, yeah, it's going to take everybody leaning into this conversation, but it's an important conversation. It's critical. You know, you think about the most important thing in your life, and if you're a parent, it's probably your kids. And what happens to them during the day while you're at work is super important. And I think for that reason, we're going to continue to have these conversations across the state, and hopefully there's some good ideas that come out of panels like this, or task forces like the one the state of Iowa put together for this program. But it's going to take everybody leaning into the conversation.
Yeah, you know, and I guess don't have a lot more to add, but you know, one thing I think that really has been a couple, I guess, two good things coming out of these funds is that some of those funds required local match. So it did get the community to the table if they weren't really involved. Maybe it's employers, maybe it's other organizations. So that really helped. And I also know of a few projects that sort of pushed them over the finish line. They were so close to already, you know, that was one of the downsides though. If you weren't kind of shovel ready on some of these, you maybe really didn't qualify, or you couldn't get an application together in time to get in there. So, but those that maybe were just so close and they've already been working on it for 2 or 3 years, it was what they needed to get them over the finish line. So that's, you know, some great things that are coming out of that for sure.
Angie, you and I talked before this panel about how best to begin these conversations. And, you know, it was about, a lot of us realize there's a need for childcare when we need childcare. You know, that's how it was for my family. And I think a lot of families, it's not on your radar until you need it, or maybe you're an employer and you realize that your employees need it, which would be great. But it's not something that you can realize that you have a need and then meet that need quickly. It's a longer process than that. So ideally you start having these conversations either now, if you're not already, so that you can be shovel ready when things like a grant opportunity come about. I don't know if you wanted to talk at all about that, but I thought that was a really interesting perspective.
Yeah. And, you know, and every project is so different, and every community, if you're talking that, you know, maybe there is a building of some sort in the community that is not in use right now, or, you know, always looking for places, we kind of co-locating. Sometimes churches have, you know, rooms that could be used as a temporary or quick place. But, you know, we get a lot of phone calls that, hey, we've decided we want to do this, or we found this old building in town and it's May and we're going to have this ready to open by the time school starts. Well, you may actually be able to get that construction done, but you're not going to have time to get the fire marshal in there and DHS. So I think to have quality care, and that's what we're hearing when we do our community studies and from the parents, is they do want licensed centers. In most communities, that's the number one choice, and then followed by a registered or regulated home. So making sure you're meeting those requirements, those things take time. And maybe that's some of those next issues that we need to look at of, are there roadblocks and barriers that could make these processes faster? That, you know, if you're waiting 3 months for the fire marshal to come and give their sign off that your building's kind of built, almost ready, but sitting there, but you can't get your occupancy permit approved, you know, is there something that can be done to speed some of these things up? But yeah, allowing enough time, I guess, is my message. It takes time, and especially if you're building or remodeling a facility.
Yeah. So where do we go from here? How do you see this effort and this conversation evolving from this point? And obviously, I mean, Dawn, you kind of talked us through how we got to this point when the Iowa Women's Foundation got involved and saw this as a need. And I don't know if you would want to talk about kind of the evolution that you've seen and maybe what you expect to see, but I'd like to open this up to all three of you. What you hope to see happen? What's the ideal?
I would say to you that I'm so excited to see that people are getting it. And that by people, I mean, you know, our businesses, our elected officials, our school people, our nonprofit leaders. I always like to ask everybody, please tell 3 people what you heard today. go back out there and share with 3 people what's going on, how West Liberty Foods is making an investment in childcare, how you could do this, how you can do that. Go talk to the leaders in your businesses if you're not that decision maker, and share with them what's being done, and how they could maybe get involved. Just keep the conversation going. Ask the questions, share the resources and the tools and the networks so people can learn from each other, and just keep moving it forward. Because as we've said, it's going to take creativity, it's going to take time. It's not going to happen overnight, but we're making such really good strides. Let's keep those going forward.
Brian or Angie?
Yeah, I'll jump in here. I would love to see the conversation continue. I think it's important that employers lean in. I think it's important that our elected officials continue to prioritize this issue. It's too important to ignore. And from an employer's standpoint, I mean, we would love to see childcare businesses. So those that are focused only on providing quality, affordable childcare succeed. So anything that we can do to help that is important. I mean, that's providing childcare is not that's not what West Liberty Foods is in the business of doing primarily. So we would prefer to defer to the experts in the space. And I think when you undertake that providing childcare as an employer, you have a special responsibility, a special obligation to make sure that you're doing that in a way that enriches and enhances those children's lives. So it is a big responsibility. It's not something that I think we want to completely put on employers, especially small businesses throughout the state, without some support. So I just hope that this conversation continues, that groups like Angie's and Don's continue to provide the support that they have for the program, and we continue to have this conversation at the state and federal level.
Angie, how do you see this?
Yeah, I guess kind of 2 things come to mind for me. The first is what I just kind of was mentioning, those roadblocks for the actual childcare businesses themselves. What do we need to get out of the way so they can do what they need to get enough staffing and have those facilities online? And there's, with all the awards the state has made in the last year, I mean, we should be having 30 some new facilities opening up in the next couple of years. So how do we get those built, finished, open, licensed, and then the staffing? We talked about things in a community meeting actually earlier this week about just the hiring process. It's important to have background checks and the fingerprinting and FBI checks done, but those things take so much time. So are there ways to do that? And if maybe a childcare worker works part-time in multiple programs, each program has to do their own background checks. They can't share them. So how can we, almost like substitute pools, like schools have, how do we get these roadblocks out of the way? And the second thing is really sustaining some of this. You mentioned in one of the questions some of the funding, such as the childcare management system that the state is going to make available, which can help with some of the business operations and the back office sort of work. But it's only funded for 3 years. So what happens at the end of that time if one of the childcare program chooses to go in and use that technology and take advantage of that opportunity? Are they building that into their own budget to start paying those fees, down the road and such? So, just kind of thinking about how we're going to sustain what we're doing today with all these new fantastic programs that are helping a lot. But will it continue to help when the funding's gone?
Right, exactly. It would be great if we got to a point where we had as much childcare as we needed and everyone was making the wages that they need to make and they all had benefits. But clearly there's still some work to be done to get to that point. We did have a question from someone who's here as an audience member. And if they asked if school districts were able to opt in to provide full day preschool using state funding, what could that impact be for childcare openings and employment? Is that a childcare funding avenue that's being considered? I don't know if any of you would know that.
I can be the Debbie Downer and go first. When I hear that, because what we do work so often, unintended consequences. It's expensive to provide care for infants and toddlers. So a lot of childcare programs rely on those 3 and 4-year-olds to be there also to offset those losses. So if we pull all the preschool age children out of childcare, now the childcare centers, the business model is even worse. So partnerships, again, between schools and childcare programs. I've seen some, even the statewide preschool, where the children stay in attendance at the childcare center, but the school district brings the teacher to the childcare center so that the child still stays there all day and they're paying tuition, but they're getting the preschool. It's possible. I have a lot of school districts as of late sort of defer and opt out, wishing it to be more of a community run because of the regulations. Department of Education and Department of Human Services regulate differently. And so there's a lot of considerations, not that it can't be done. There are school districts doing it, but being careful that it does not unintentionally hurt the other childcare programs in town.
Right. Well, we are very close to the end of our time here, and I just wanted to thank all 3 of you and our audience. I think this was a great conversation about an issue that's so important, not just for families, but employers and really everyone in Iowa. We want our children to be well cared for and well educated, and it's just, like I think Brian said, what is more important to us than who is taking care of our children and how they're being cared for. So thank you to our panelists and to our audience for joining us today. This session was recorded and it'll be available on the Iowa Ideas website starting next week. So if you only caught a part of it, or if there's some part you want to go back to, certainly go back to the recording, because there was all kinds of really good information that was shared by Dawn and Angie and Brian about resources that are available and programs that are having success, or communities that are having success with this. So thank you so much to all 3 of you for joining us. And yeah.
Thanks.
Bye, everybody. Thank you. Have a good day.
Yes, there are more sessions coming up. We have a little break here, but then we have sorry, I've got to pull up my schedule. This is how well prepared I am for this. But definitely, if you're registered for this, everything is free and available. There are lots of great conversations happening all day. We have a lunch break here, and then we will have a conversation with Director Durham and Director Townsend from the state, and then we have sessions all afternoon. So definitely come back and join those and participate. All right, well, thank you so much.
Bye.
Bye.